me, just in this introduction, to mention the purpose and don't need to put any chief complaint or provisional diagnosis or something like this.
Does it say it here? Do you get any marks for that?
No marks for that.
Okay. Is that a requirement? No, it's not a requirement. If you want to say it, if you think, do you need to say provisional diagnosis? Not here. You said you're a surgeon, yes?
Yes.
Okay. If I write to you a letter and I say, okay, doctor, I'm sending you a patient with chronic abdominal pain and his right upper quadrant pain, and my provisional diagnosis is, for example, gallstones. Could you see this patient, please, and confirm my diagnosis and do a surgery if necessary? How do you like this?
Not too much.
Okay. Because I'm a doctor, you're a doctor, we're colleagues, but you are, I'm asking you to do something for me. You're more senior. So I can't tell you what to do. Or you say, okay, doctor, I'm sending this patient to you. Please do an ultrasound and see if it is gallstone. So you say, so why don't you do it yourself? So why are you telling me what to do? I know my job. You're not supposed to tell me. Okay? Right? So basically, yeah, to say what my provisional diagnosis is in the first paragraph is offensive. Even if you want to say it, you can say it in this last part. You can say, well, with what I have said, my opinion is that this patient might need an ultrasound or a further assessment of gallbladder if you think appropriate, if you deem appropriate. Okay? So even if you have a provisional diagnosis, you say it in the last paragraph. You say, in my opinion, this patient has gallstones, but I'm not sure, and that is why I'm writing to you for a second opinion or for your expert opinion. Okay? So when you're writing to a specialist, you can't tell them what to do. Yeah? And you cannot tell them that this is my provisional diagnosis. You just confirm it. No, it doesn't make sense. So what we say is, yeah, this is the presentation. You can say suspected if you want to, but not provisional. You can say, I'm sending you a patient with suspected acute appendicitis, because we want to save time. We don't want to say, we have to be clear. I said with suspected acute abdomen. If you're sending a patient urgently, you need to be very clear. But write suspected. Don't say with provisional diagnosis of acute abdomen. What is provisional diagnosis? What is that? What is provisional diagnosis?
Possible diagnosis or the diagnosis that I think about beforehand.
Provisional means it is a diagnosis until otherwise proven. Okay. This is something which we call it an Indian English, and it's an Indian medical terminology. We don't usually use it here. We say, you can say a preliminary diagnosis or an initial diagnosis or an impression. Okay. So, yeah, that's the other reason I'm saying not to read that 400-page book, because some of that is actually not the English we speak here. It's broken English. It's the English which is spoken in other countries. Okay, right. So in a way, I would say, probably you could say the best way is suspected, and that is only if you want to be very clear to save time, and it is so important. For example, well, if I have a patient who has appendicitis, I wouldn't say I'm writing to refer this patient with abdominal pain, okay? because I want you to take it serious and to look at it quickly. So I have to be clear. Say suspected acute appendicitis, then you take it serious. Okay. So if I say abdominal pain, okay, abdominal pain, and then I read it and you write a story, and as I'm reading, I say, well, so this means appendicitis, so why didn't you say appendicitis in the first place? Or why do you say it at the end? Something which is so significant, okay? Right, okay. This is all logic. This is medical judgment. Okay, this is clinical judgment. So you need to. We will discuss this later more, and we will talk about what should be right here. Should I write presentation? Should I write diagnosis? Should I write suspected diagnosis? But yeah, most of it is logic. So okay, right. So now the most important part of a letter is the purpose. Okay, if you get the purpose wrong, the whole the other parts are all wrong. Okay, basically, if you get the purpose wrong, you're writing a wrong letter. Okay, so that is so important. All right. So let's go to our next important part. Okay. So as you basically this is our this is the way we work out what we're supposed to do. We look at the way we are marked, okay, and therefore we get our targets. These are the sub skills, okay. Remember, I just take you back to here to remind you what we're doing. Basically, for an exam, what we're trying to do is find out what skills are required and then improve them, okay, and familiarize ourselves with the format of the test, okay. So basically, the first one was purpose, and now the second one is content. Okay, I take these out. Okay, and what does that mean? Well, as you said, it is very important, but how important is that? 7 out of 90, 7 out of 38, or 90 out of 500. But it is even more important that, and I will tell you why later, okay? Okay. So let's see what the content needs to be. So we're here. Content is appropriate to intended reader, okay, and addresses what is needed to continue care, what is needed to continue care. So it is a key information is included, okay. No important detail is missing. Content from case notes is accurately represented. Okay, so we have some keywords here. Appropriate intended reader. Okay, write it here. Appropriate to intended reader. Okay, and what else? What is needed to continue care? Okay. What is needed to continue care? And then key information is included. Okay, key information is included. No important point is missing. Yeah. So no important details, and the content is accurately represented. Okay. No important details, and okay. and accurately represented. Okay. Right. So we see there are a lot of things here. Appropriate to intended reader. Well, who is our intended reader here?
Endocrinologist.
Yes, here is the endocrinologist. Good. And what is needed for continued care? What is needed? Now we have to decide that. The key information is included. What is key information? No important details are missing, so and accurately represented. Okay. Right. Let's go back to Mrs. Sharma. Okay. Now, basically, we need to find what content is relevant and what is not. Okay. So I make my way upwards. Okay. I start from the last entry and go up. And you tell me what is significant or what is key information, what is just good to know. 6th of February, pathology report received cholesterol 3.2, TREG 1.7, LDL-C 1.1. Should I highlight it?
I think so because blood fat is relevant to deal with
Okay.
the patient.
Okay. 30th of January, home BP in range, sugars improved.
Might be important, but
Might be.
yeah.
Pathology requested fasting lipids full profile.
Yes.
I will say no, but I will tell you later. Well, let me say this way. If you say, should I say, well, I made some coffee and then I drank it. I made coffee and then I drank it. Should I say that?
No.
Okay. Should,
Yes.
should I say, I examined the patient and his abdomen was tender.
When
Should
we
I
say that the abdomen is tender, so it's obviously examined.
We
Already examined.
Okay. So pathology requested and the results are these. Should I say that?
No.
Yeah. Unless we want to emphasize that, okay, pathology was requested on this special date and the result came back on this special date. Okay. We don't usually do that. Okay. 12th of January, review of pathology results. Now, should I say this is not relevant? Review of pathology results? Well, obviously, if you have pathology results, you will review the results. Okay. Okay. Changes in medication recommended.
Simple.
That is significant. Metformin changed. Okay. Atorvastatin added. Glipizide. Review 2 weeks. Should I say that?
Don't need.
We don't need it. If we want to emphasize, we will add it later. 5th of January, pathology received. Should I write this? No, we don't need that. These are normal. Is that something to say? Normal? Is that significant to say these are normal?
No.
No. GFR more than 60?
It's important.
For diabetes, HbA1c. Do I need to say very poor control?
No, because
To-
it's apparent from the range of HbA1c.
Yes. So, and if I write it for an endocrinologist, they will be offended. They'll say, well, I'm not stupid. I know it is very poor control. Okay. And lipids are high. Yeah. So we don't need to write high. Okay, and here we go. This is on examination, so we go up here, 29th, and concerned that her sugar levels, glucose levels are not well enough controlled. So this is still about glucose levels. Okay. Now, what if it says, well, the patient has got pneumonia or has got cold? Should we include that?
Yes, the stressor factor.
If we say, if we have an entry here that says common cold, should I write that?
No.
Not a
No.
call, probably. No.
Okay. So we need to decide whether it is relevant to our case or no. It's something that we should just forget. Okay. Or if, for example, it says, yeah, the patient comes in with, let's say, um, um, diarrhea and vomiting. Should I write it here?
Yes, probably.
Yes.
Why? I
Because
mean,
of PK, probably a presentation of like PKA or something like.
You know,
right.
the effect of diabetes on GI tract, like, some autonomic dysregulation of
Right.
sympathetic parasympathetic of the small or large intestine.
Okay. Okay. Well, if you write that, you need to write the relevance. Okay. If you think it is relevant, if you just write it and say, okay, maybe it is relevant, and well, I write it anyway, the reader should decide. No, we don't do that. So I would say it is not relevant unless you tell me why it is relevant. Okay. So if you write, for example, yes, for example, on the 4th of January, this lady had diarrhea and vomiting. And so what does it have to do with me, an endocrinologist, to deal with her sugar levels if she has had a diarrhea? Okay. Even if you say, well, because I think this might have been some abnormality in the some kind of neuropathy. Okay. Well, okay. So we have to explain the relevance if you want to include something like that. Yes.
So this is not actually a medical knowledge exam. Uh, my impression is that like if they want to include something relevant, they probably say in the scenario that this might be like relevant to the current medication. Like let's say this one diarrhea. If they want to say that this diarrhea might be relevant to the current diabetic patient, they probably say that like it's probably a neuropathic
Yes.
like side of something related. Somehow they relate it to this current situation. Otherwise, we won't need to include that, right? I don't know.
Exactly. Yes, absolutely.
We
Yes.
don't need to justify that actually somehow.
No, not that much. That's what I'm saying. If it doesn't say it there, it means that it's not relevant. Okay. If it is, if they want you to include it, yes, they emphasize something. They give you a clue. They say, okay, and for example, diarrhea and vomiting possibly due to neuropathy, for example. But if it doesn't say that, you should just exclude it because it's not relevant to sugar levels or to endocrinologist.
And one other question, sorry, you are coming from the bottom of the page to the up. Is it like different, or it's better to do it this way, like going from the
end to the beginning,
from the current
Right.
like information to the.
Well, the reason is because basically we want to know where this presentation started, and basically I want to go back to the date that everything started, and that's why I make my way upwards, because I found out the reason, and then I go choose only those that are relevant to uh, this management, this referral, and if I find that it finishes here, I don't go upwards. The rest would be past medical history or irrelevant. Give you an example. Now, if you look at this, this patient says, no, it is admission to A&E actually. This is relevant. Now, if you have a patient who comes in, there are 4 entries. The first 2 entries, one of them is cough and cold. The second one is, for example, infectious mononucleosis. And the third one is tiredness. The fourth one is diagnosis of diabetes with HbA1c. So therefore, you're going to refer this patient, okay? So if I'm going to refer this patient, and last week the patient came in with tiredness, then I go upwards, then I see infectious mononucleosis. I said that is not relevant. Then I go up, there is common cold. It is not relevant, okay? So I delete those. Is that all right?
Yeah. Yes.
Yep. Okay. Okay, so yeah, so in this case, we were going upwards to, yeah, 29th of December, concerned with blood sugar control. Attends health center, blood sugar levels are 6 to 18, and checks BP at home. Is that significant?
No.
No.
No. Last I checked, October 2017. Okay.
Yes.
Weight steady. BMI 24.
Yes.
Okay. Appetite good. Good diet.
No. Maybe good diet.
Not really. Bowels normal. Micturition normal.
Yes.
Why?
No.
Just because of neuropathy, which is sometimes important.
It says
for
here.
diabetic.
It says no
Okay.
peripheral neuropathy. Okay. Physical examination normal. No abnormality detected. BP, is this significant?
Yes.
Okay. No peripheral neuropathy. Pelvic exam not performed.
No.
Pathology requested.
No.
Medication added.
Yes.
Okay. Okay. So, right. So basically, we have a patient who has come in with high glucose levels and has had diabetes. Okay. We go and look at the background. So her name is this, date of birth is significant because that is the denominator. So that is, like we say, father's name in Persian. Here we say Priya Sharma, date of birth, 8th of May, 58. Okay. If you don't have date of birth, you write the address. Social background, married 40 years, is that significant?
No.
No. 3 adult children?
No.
No. Retired? No.
No.
Some people write 60-year-old retired clerk. Well, not good. I don't think it's appropriate. Family history, many relatives with type 2 diabetes.
Yes.
Everybody says it is significant, but I don't think it is because you know
Because
this.
she already has.
Yes.
Yeah.
Yes. Because she has been diabetic since 1999. We're not diagnosing it. And so how long she's been diabetic is relevant. Allergic to penicillin, we say always allergies are good to know, are relevant. Menopause 12 years ago,
No.
no. Never smoked, no alcohol,
Yes.
maybe. Okay.
Maybe.
No formal exercise,
Maybe. No. No.
okay. And metformin, the drugs are current drugs, metformin, glipizide, no other prescription or the over-the-counter or recreational. Okay. So